I want to thank Dr. Terry Mason, Chief Operating Officer of Cook County's Department of Public Health, and Bill Barnes, Executive Director of the county's Department of Emergency Management and Regional Security, for joining me this morning. Unfortunately, we all know that COVID-19 claimed the life of a Chicago woman this week. I offer my condolences to her family. There aren't sufficient words to ease their pain. We now have 75 residents in suburban Cook County who've tested positive for this virus. That's 17 new cases. I know all our residents join me in wishing them a quick and complete recovery. My administration is working diligently to keep our community safe and informed during this COVID-19 pandemic. As we've seen, the virus-related developments can be fast-moving, and the importance of quick, accurate, and trustworthy information cannot be overstated. With that in mind, I'm announcing the availability of several new resources to assist the public by providing timely and accurate information. Cook County is launching a text service providing useful information related to COVID-19. By texting ALERTCOOK, that's all one word, ALERTCOOK, to 888-777, our residents can receive rapid, simple, and direct updates related to this virus. Texting is an extremely powerful tool and provides efficient and direct communication with the community. Residents can know that they're receiving confirmed and correct information from a trusted source. And this morning, Cook County launched a new hotline that will provide vital information and updates from the county's Department of Public Health. Residents can call 708-633-3319. That's 708-633-3319 to ask public health professionals questions related to COVID-19. The Department of Public Health also created a dedicated email, ccdph.covid19@cookcountyhhs.org. That's ccdph.covid19@cookcountyhhs.org. We encourage you to use these resources to help your family remain healthy and safe. We're committed to being accessible and keeping our residents well informed. It's our hope that providing this information via hotline and texting, we can combat misinformation while providing potentially life-saving updates. The county's Emergency Management Agency has been working around the clock to coordinate our response to COVID-19. We are working with each of our 135 municipalities, fielding hundreds of requests for resources. We're also in close collaboration with our counterparts in the city, other counties, at the state and federal levels to ensure that we're doing everything we can to respond to and mitigate the effects of this pandemic. Our Department of Public Health continues to work with healthcare providers throughout the community, as well as the Illinois and Chicago Departments of Public Health, along with the CDC, the Centers for Disease Prevention and Control, to safeguard all of our residents. I welcome now our Chief Operating Officer of the Department of Public Health, Dr. Terry Mason, to give us an update. Terry?
Thank you, Madam President, and good morning.
Good morning.
Before I get started, I would also like to express, as the President already did, our condolences to the family of the person that recently passed away in Chicago. Sadly, this death is an important reminder that while most people will recover from COVID-19, we still have to be concerned about those who are most at risk, such as the elderly and especially those with underlying health issues. Social distancing and closures, though inconvenient, are absolutely necessary if we are going to try and protect our most valuable vulnerable populations and curtail the spread of the disease, for which we have no medicine and no vaccine. At Cook County Department of Public Health, we have seen the case counts in our jurisdiction of suburban Cook County quickly grow to a total of 79 cases, including 17 new cases. Cook County as a whole, including Chicago, has 178 of the 288 cases in the state of Illinois. Since the first COVID-19 case was identified on January 24th, a Chicago area resident, we've been working around the clock with our public health counterparts at all levels of government to respond to what is now a pandemic. This has included case investigations, contact tracing, monitoring, disease surveillance, and control, and providing some situational updates and guidance to the public media and partners. This has truly been a rapidly evolving situation for all of us. With all the recent closings and cancellations of school and work, there has understandably been a lot of confusion, and people have a lot of questions and concerns about what to do to protect themselves and their families. As we have begun to see signs of community spread in our area, we began to see a spike in calls that necessitated mobilizing a team to respond to the increasing demand. That is why I'm very excited to be here along with President Preckwinkle to announce the activation of our COVID-19 hotline and email address for members of the public to get answers about COVID-19, questions from the public and professionals. For the latest COVID-19 mandates from Cook County, updates from Cook County Department of Public Health, you can call, as the President has mentioned, CCDPH COVID-19 hotline at 708-633-3319. That's 708-633-3319. That email is cdph.covid19@cookcountyhhs.org. Staff will be on hand to respond Monday through Friday between the hours of 9 a.m. to 4 p.m. Now more than ever, we must each take responsibility for ourselves and our neighbors. Using good old-fashioned public health strategies like social distancing, hand washing, covering coughs and sneezes, and staying home when sick. I implore each and every one of you, please stay home if you are sick. A physician referral is required for all testing, including the new mobile sites that you may be hearing about on the news. There are things that are totally within our control, and we as a community owe it to each other to all do our part. This is critical to success. We may not be able to stop this disease, but if we all do our part, we can slow it down. Thank you.
Now I'd like to ask Bill Barnes, who's Director of our Department of Emergency Management and Regional Security, to say a few words.
Thank you, Madam President, and thank you, Dr. Mason. To repeat, the name is Bill Barnes, B as in boy, A-R-N-E-S. I'm the Executive Director of the county's Department of Emergency Management and Regional Security. And I want to start this off by thanking the Madam President and Dr. Mason for both of their hard work and collaboration in this critical time. And I want to express that I, too, am extremely saddened by the passing of the COVID-19 patient in our community, and my condolences go out to her family. This is an extremely challenging time for our county, for our state, for our country, and even our world. Given the gravity of this situation, I am grateful for the leadership of President Preckwinkle as we navigate this evolving crisis. Our main goal as the county's emergency management agency is to make sure that everyone has the information and the assets that they need to accomplish their individual roles in disaster response. That is why we are launching ALERTCOOK County. This text messaging system is a critical tool to alert you, our residents, to the latest information about COVID-19. We realize the situation on the ground is changing rapidly. We want to make sure that we can communicate directly with you the most up-to-date information as possible. In this time of internet connectivity, you could go to our website, you can follow us on social media, but this opportunity gives us the ability to contact you directly with information. In times like these, when easy access to timely information could literally save your life, this is a vital resource for all Cook County residents. Residents can now text ALERTCOOK, one word, ALERTCOOK, to 888-777. That is 888-777 to receive relevant and helpful text messages from Cook County as information becomes available. Now, over the past few weeks, we have taken crucial steps to protect our residents and combat this pandemic. Last week, the board president, Preckwinkle, signed a disaster proclamation. This step was taken in direct collaboration with the state of Illinois, which signed its own declaration on March 9th. This very week, during a special meeting of the Cook County Board of Commissioners, the board extended the county's declaration and its emergency powers to allow for continued decisive action during this crisis. This pandemic knows no borders and is impacting the entire state and country. We have therefore worked closely with the state, county municipalities, and their health departments to coordinate our response and share information. To accomplish this, the county has activated its Emergency Operations Center in Oak Forest. This allows us to more effectively collaborate with other county agencies and our partners in the public and private sectors. Equal in importance to information are resources to respond to this pandemic. We have received and are processing over 300 requests for resources from local municipalities. For example, we are working closely with the county's first responders, fire, police, emergency medical services, to get them the critically needed personal protective equipment they need to do their most important jobs. And we are planning for potential future needs throughout our community so that we may be better prepared to assist our partners. It takes a county to respond to a disaster. We cannot do it alone. As such, we rely upon all of the other entities that are involved in disaster response: county agencies, separately elected officials, public safety stakeholders, local municipalities, and you, our residents. Ultimately, we do all of this because the safety of our community, our residents, who are our neighbors, our friends, and our family, is of utmost importance to us all. Thank you.
Thank you. Are there any questions? Well, this is a decision that that municipality made. I guess my basic view is that it would be best if we had a consistent statewide policy on this issue. I talked with the governor yesterday, but not today, and I'm not sure where he is on this subject.
Our hotline will be open at 9 o'clock this morning.
Dr. Mason, I'd like to ask, now that obviously
Well, I think the lessons learned are cumulative, not just from what we learn about here in the United States, but the history of how the virus spread it in other parts of the world. This information is being used and modeling is beginning to take place to determine what the projected trajectory of this disease may be in the United States. Though we don't have a crystal ball, we do take our best academic guesses at this. You've probably heard folks from the Centers for Disease Control and other people who are looking at this and doing this modeling. And it's this which is guiding the practices that we're trying to putting into place right now, namely particularly the social distancing and some of the opportunities that we've taken to sort of decrease the places where people can go and congregate. As we learn more, we will implement more. But that's what we're doing now. Well, as I mentioned in our remarks and the President mentioned in her remarks, we are most concerned about the elderly, many of whom have underlying conditions, particularly those conditions that may affect the ability of their lungs to recover from the infection caused by the virus, and also may be diabetic and may have congestive heart failure, other issues. So those are the people that we're most concerned about in terms of getting the care that they need in the facilities that are best suited to provide that care. So remember, we're in a situation where we have a disease for which we have no medication and we have no vaccine as of yet. So those are the two things when you're dealing with a virus, all we're dealing with now are the complications that the virus causes. But we're hopeful that vaccines and medications will be coming available over the coming months or year.
Can you talk about what specific kind of tests are going to be the ones that you decide to send out on this service? I mean, what is the information people are going to be getting?
I'm not sure I understand your question.
Are you giving, when you say you're going to get updates, is that on how many cases there are, hints about what people should do? I mean, what are the kinds of things that are going to be available?
All of those things that you mentioned, in addition, if people want those case counts, they'll be available. If people want to know things about what they can do, how they should access testing, as you know, there are other private concerns that are setting up testing right now. We want to make sure that people know, even if they're going to get one of those tests in those facilities, they still need a physician referral to get that test. So they just can't walk in and get it. They'll need to get a referral from a physician in order to access that service.
Now, is this going to be coordinated with the state websites and that kind of information? I mean, how are you going to make sure that all of the information going out is the same information?
Absolutely, and that is where the coordination takes place. We have been working with everyone from the federal level to the state level at the local level as a team. This is not done with one-offs. This is done with the best that we have in the science that's shared through the agencies that we have and the experience of others.
And how many people are staffing the hotline?
I'm sorry?
How many people are staffing?
We are opening the hotline this morning with 6 staffers on the phone. We will regulate that based on the volume of calls. And if we need more, we have other staff that can take on those additional responsibilities. In addition, if the lines get overwhelmed, there is a answering machine or answering service that will take and record those questions that staff will get back to the people offline for those questions.